and across the United States of America. I want to give you guys a little bit of information about Dr. Modlin. Dr. Modlin is a kidney transplant surgeon, urologist, and founder of the director of the Minority Men's Health Center at Cleveland Clinic. And one new fact that I just found out about Dr. Modlin when I looked at your resume is that you are one of 17 transplant surgeons in the United States of America, one of 17 African-American surgeons in the United States of America. That is powerful in itself. So with that, I want to just thank you for joining me today, and let's get right into this very important conversation because I know you are very busy at the clinic. Now, the reason I asked you to join us today, Dr. Modlin, is because I'm really concerned about what's happening in our community. I'm really concerned about the constituents that I serve and others that are not in my district who do not believe that we are in a crisis. They do not believe for some reason that they can be impacted by the coronavirus. So before you answer that question, I know your 18th annual Men's Health Fair is scheduled for April 23rd. Can you tell us a little bit about what's going to happen with that conference and going forward and why you actually hold that conference?
Sure. So, unfortunately, because of the coronavirus pandemic, we actually had to cancel the health fair due to social distancing requirements. That was actually going to represent our 18th annual Minority Men's Health Fair. And the reason it's a men's health fair, I'm a urologist also, and our initial target disease that we wanted to address as urologists was prostate cancer. Black men develop and die from prostate cancer twice as often as white men. And we started the health fair back in 2003. The first year we had 35 men show up, and this gives men, regardless of race or ethnicity, an opportunity to come in to get free health examinations, free preventative health screenings. 35, I thought that was actually a pretty good turnout. The last several years we've had 2,000 or more men of all different ages, and we've actually expanded the health fair from the main campus to include a total of 4 simultaneous locations: Akron City Hospital, Lorraine Family Health Center, Lutheran Hospital, and the Cleveland Clinic main campus. And again, it was designed to eliminate health disparities. African Americans also have a higher incidence of diabetes, hypertension, heart disease, colon cancer, prostate cancer, lung cancer, heart disease, kidney disease. African Americans develop kidney disease 2 to 4 times, and actually in some areas 4 to 6 times more commonly than white individuals, have a greater need for kidney transplantation, and the list goes on and on. And so that health fair was established to address a lot of these healthcare disparities, which in fact is one of the reasons we are here today. And I'll let you, I don't know if you're ready to get into the coronavirus discussion, but it relates to the disproportionate of chronic diseases that the reason why the coronavirus is disproportionately afflicting African American populations.
Can you please, first of all, thank you for the conference. I've been to your health fair almost every year, and
Yes.
It's always a great turnout. And when people leave there, they are so thankful for what you've done and all the volunteers that you have there that are helping people. And that might be the only time people actually go to the doctor.
Very much so. Very much so. Actually, I've encountered a number of men, and so we have the health fair, but a lot of people don't realize we actually have a Minority Men's Health Center that actually evaluates patients. It's operational, it's functional throughout the year. Every Wednesday, main campus, every Tuesday over in East Cleveland at Stephanie Tubbs Family Health Center. We have periodic clinics over at South Point Hospital as well, one of our community hospitals. And so we're here year round doing things. We actually established April 2019 a Minority Stroke Center. And we're in the process of establishing these health equity or health disparity programs within all the different Cleveland Clinic institutes, because these health disparities are rampant. And we want to use the expertise, the innovation, ingenuity of Cleveland Clinic to actually address and eliminate, find solutions for these health disparities.
Well, that is excellent. Keep up the good work. So that goes right to my first question. My first question is, again, can minorities, Latinos, African Americans, low income people catch the coronavirus? And I'll tell you why I asked that question. I was talking to a few people, and they just simply do not believe that this is a virus, a disease that can impact them. And you can see that every day. I had a constituent call me and told me that there were about 30 people in the front lawn and on the porch, not too far from me, right in the Buckeye Shaker area. And they were just congregating as nothing happened. They were not 6 feet apart, and they were definitely in close proximity to each other. I had another young lady call me and ask me if it was okay for her to have her 60th birthday party. I said, well, you know, you have to be 6 feet apart, and I'm not sure how you can do that. And she said, but I'm turning 60. I just want to have my party. I don't think anybody will get sick. Can you address whether or not people can actually catch this disease?
Sure. You know, initially, actually, I had a number of people approach me, and they were saying, well, you know, we don't believe that Black people can actually acquire the coronavirus, and there weren't really any statistics to point toward the fact in terms of the racial or ethnic, you know, background in terms of those afflicted. But actually, last week was the first report I saw from the state of Ohio, the Department of Health, that showed that of all of the people in Ohio, and I'm sure the numbers are probably even higher now, but of all the people in Ohio a week ago who were tested positive, 19% of those positive were African Americans. Yet we only represent about 12 or 13% of the statewide population. And so we actually are acquiring the disease at higher rates than our percentage population. And you know, what more, there was a report from the city of Chicago that demonstrated 50% of all of the individuals who had tested positive for the virus in Chicago were African Americans. But what's even more disturbing was 72% of those who expired or who died from the virus were African Americans. And so again, a disproportionate burden is placed upon African Americans. And as healthcare providers, we've kind of wondered, you know, why is that the case? Well, there are a number of contributing factors. I mean, there are social determinants of health factors, health disparity factors. It's felt that those who are most susceptible to getting the virus and succumbing to it are those individuals who have pre-existing medical conditions or chronic diseases. You know, we mentioned hypertension, diabetes, heart disease, asthma, lung disease, you know, different types of cancers that actually lower the body's ability to fight infections that cause immunosuppression. So from the outset, African Americans are at a disadvantage because we actually suffer higher rates of all these conditions. So we actually fare worse than the general public when it comes to acquiring and succumbing to this coronavirus. So we indeed can actually acquire the virus. We can die from the virus. And researchers actually know that an individual does not have to have any signs or symptoms. You don't have to have any fever. You don't have to have any cough to actually harbor the virus within your body. You could be a carrier, is what we call it, asymptomatic carrier. And so you actually can have your 60th birthday party, but with all the people congregating together, somebody among you, even though they may not appear sick, can actually spread that virus. So, you know, we do advocate that, you know, all people, even African Americans, we need to practice social distancing. We actually have to, you know, practice hand washing techniques, try to avoid touching our face as much as we can. A lot of times it's unconscious. We don't even know how many times we're touching our face. You know, when we go out in public, it's recommended now, and again, there was some controversy about this initially, that we cover our face with a mask, even with a homemade mask. And I know there are some concerns. I've seen some newspaper articles, online articles that some Black men, I think there was a professor down at Ohio State who went on record saying that he is not going to be seen in public wearing a mask due to the social implications of that. Historically, you know, a Black man, Black woman, Hispanic, Latino wearing a mask out in public, going into a store, I mean, that is associated with criminality. And so also, a lot of times we live in higher density areas. We still have jobs that require us to use public transportation. We may not own our own cars. We may live in a household where there are more people living in close quarters, apartment buildings, you know, things like that. And again, a lot of times we just may not believe that it applies to us. So we need to take this very seriously. This is a pandemic. We don't know whether or not we've hit the surge yet here in Ohio or across the country. So we need to actually adhere to these social distancing recommendations.
Excellent. Thank you so much. I hope people take this seriously because I
Yeah.
want to make sure everybody stays alive until you professionals can actually figure this out. So about 2 weeks ago on my call with the governor, with the rest of the Senate Democratic caucus, I explained to the governor how people were really not adhering to his message and asked if he would start releasing those numbers that you saw last week on his screen. And I also want to just highlight state representative and minority leader Amelia Sykes out of Akron, Ohio. She has been a champion in dealing with public health since she's been in the legislature, and she has been working hand in hand with the governor to make sure that he releases that data also. So I asked the governor for him to release the data based on race, to release it based on census tract, and to release it based on zip code so we can drill down into it and do a little bit more. And talking to health professionals, that appears to be the best way to try to tackle this issue and other issues as we move forward. Can you tell me what you guys can do with that information once it's broken down to the census tract level, the lowest common denominator?
Well, first of all, I wanted to thank you actually for encouraging the governor to release the data according to, you know, race and ethnicity. Oftentimes, you know, we as advocates of the minority community, a lot of times we realize the importance of that, but we can't automatically assume that everybody understands why that is important. We're not asking for that data simply to have that data so we can point fingers at individuals. You know, it's specific. There's a specific need for that data so that, like you say, it can be put to action. We want to take the data and then put it to action with respect to developing programs to specifically, you know, understand why certain segments of the population have a higher incidence of this disease, you know, in this case, coronavirus. Having this data can actually help caregivers, healthcare providers drill down to determine whether or not there are any areas, zip codes, for example, locations in the community where we need to actually provide screenings. You know, we may provide screenings in one area where you can drive up in your car and you can get the test. You know, right now you have to have a physician order to get, you know, screened. And knowing that there are these disparities will help us determine in which communities we need to ramp up our screenings, in which communities we need to ramp up educating, you know, members of that community, utilizing surrogates, elected officials such as yourself, clergy, influential people in the community, elders in the community, statespeople in the community, to actually help deliver that message. A lot of times physicians and caregivers can deliver a message about health, but it goes unheeded. And that's why we've had so much success in our Minority Men's Health Fair over the years, because we understand the value of using surrogates and partners and collaborators to actually help deliver, you know, these life-saving messages. And so for me, it's important that we get the data. I've actually brought the data to light at our recent Board of Governors meetings, and the CEO, Dr. Mihalovic, was present. And I emphasize the fact that this data is very important so that we at Cleveland Clinic actually can look to locations where we can actually better serve the community. And I want to commend Dr. Mihalovic and the leadership of Cleveland Clinic for the work that they're doing, the caregivers at Cleveland Clinic who are passionate, and they're essentially, you know, actually quite literally putting their lives on the line every day, you know, going to work to serve the community and combat this devastating, you know, pandemic. And so I want to take my hat off to all of them and applaud them. I want to take my hat off to you and you know, the leaders in the state of Ohio, the Black Caucus and Ohio Commission on Minority Health and others who are advocating for the Black community, because again, it all relates to providing more resources to those in need. And again, it can't be a one-size-fits-all approach. We actually have to reach out to those who have chronic diseases, because again, those are the ones that are most affected by this.
Thank you very much. And I want to echo your comments as well, Dr. Mihalovic, Dr. Wiley, the entire team there working alongside you, the nurses, including my nieces who work at the Cleveland Clinic. I want to thank you guys again for that. And also Dr. Angela Dawson, not doctor, but director. She's great, and she's always been a wealth of information. So you made a comment that that I want to pick up on. I've received a lot of telephone calls from people who have tried to get tests and they were not able to get tests, not just in our area, but around the entire state. We had one man who went to the emergency room 3 times and he was turned away. They sent him back home after they saw him, refused to give him a test. He came back. He was so ill he couldn't walk, and he had the coronavirus the entire time. Not only did he go to work every day when he was told, you know, just go back home and rest, his boss wanted him to come to work. He went to work, and his entire group of people that he works with in the construction industry ended up sick.
Oh, wow.
So what I'd like to know is, number one, is there under testing in the African American community? And are there enough tests yet for people to actually be tested on a regular basis? And he's not the only one. I had some calls from people who have been ill according to them,
Right.
and they just cannot get one of those tests.
Mm-hmm. You know, I think, you know, we received some of the data from the state of Ohio. We've heard some of the data from other locations, Chicago, other vicinities. I think actually there is underreporting. I think the percentage of African Americans who are afflicted as a part of the whole is actually probably higher. I think I saw some data that those initial medical forms did not include, I think in maybe 30 or 40% of the cases, did not include data on race or ethnicity. So that just means that there's potentially underreporting in terms of race or ethnicity, and could be afflicting African Americans even more. So I've encouraged Cleveland Clinic also for us to make sure that we look at that data as well. You know, Cleveland Clinic actually is providing testing, and I've referred a number of patients to have the test. And in many instances, the people are getting results within 24 hours. It depends on where you go in terms of which tests they're running and in terms of how long it takes. I think, and we've heard in the news that there has not traditionally you know, to date been enough materials or enough kits to do the testing. Right now, the testing is limited to individuals who exhibit certain signs or symptoms of the disease. With more availability, I think we can test more individuals, not only locally, but in the whole nation, so we can get a better understanding what the true incidence of this disease really is. You know, so, you know, those are very important points. I think nobody really anticipated this happening to the extent in which this happened, you know, this pandemic. So again, we do need to offer more testing to more people, and we need to offer it in minority communities as well. So you know, those are all great points and things that we need to really work on.
Good. Now, can you explain what a false negative is?
So a false negative is where you actually have a certain disease or condition, and you have a test. It could be a blood test, urine test, could be an X-ray, a CAT scan, and the sensitivity of that test is not such to be able to detect all cases, and so you are reported as being negative. Actually, in medical terminology, negative is good. It means that you don't have the condition. In the case of a biopsy or for cancer, if we say you have a negative biopsy, that means you don't have cancer.
Okay.
So in the case of this coronavirus or other testing, there's a certain level of sensitivity that any given test will have. And so there are situations where you actually may have the disease, but the test says that you don't. It just emphasizes the fact that if you have symptoms, and even if you test negative and you still have symptoms, you know, around a certain particular disease, it's important that you go back to the doctor. Many people don't actually have primary care doctors to start off with. And, you know, we encourage that individuals have routine primary care physicians. In the case of men, I always say every man needs a urologist. We deal with male issues, you know, issues of the prostate, the bladder, and male reproductive system, sexual health. Most women have an OB/GYN. Every man needs a urologist. Every woman needs a primary care physician. But actually now more than ever, due to some of the new policies, thanks to you and other leaders due to the new policies where we can do telephone consultations, virtual health consultations over Zoom or different modalities or just over the telephone. It's easier now ever than before to access a physician. At Cleveland Clinic, you just call 216-444-2273 and talk to the operator, tell them you'd like to get an appointment with a physician, and they'll schedule an appointment, with a primary care physician who can then put you in touch with any other specialists that you may need. And so I'm encouraging everybody to take advantage of the opportunities that are now prevailing themselves for everybody to have access to consultations, to primary care providers and specialists.
Okay, excellent. I'm going to make sure I post that telephone number on my site. And I actually did just have a doctor's appointment for the first time online yesterday. And it was very convenient. I didn't have to drive to the clinic. I just got on my phone, spoke to the doctor, and we're going to see each other a little bit later. But I loved it. I just went back upstairs after I was finished and was gone. So we will definitely post that. No, it's 4:25. This was just a 30-minute block of time. So I wondered whether or not there were any questions, Kayla or Millie, that have come through Facebook at this time. I can't hear you, Kayla.
Yes, we have one question right now, and that is from Larry. He wants to know, as minorities are impacted disproportionately, is this even more dangerous for those minority members who are also economically disadvantaged, including homeless individuals, sleeping outside with and lacking adequate nutrition?
That's an excellent question. And I would say the answer is yes. Economically depressed individuals, regardless of race or ethnicity or distinct disadvantage, even especially African Americans who have the higher rates of chronic diseases. Economically depressed individuals, like you said, they're sleeping outside, they're more susceptible to not having adequate nutrition. And that actually lowers their immune system. They eat, poorly. They have a greater incidence of pneumonias and other types of infections. I was speaking to somebody, and they actually suggested, now more than ever, there's a lot of empty hotel rooms in the city, the county, throughout the country, and it would be phenomenal if we could actually devise a way to be able to take advantage of those empty rooms to house the homeless, especially during this pandemic, so that they too can social distance. The thought that had occurred to an individual to actually raise that awareness to me, and that's something that we really need to look at for the long term. Doing what we can do to curb this homeless situation that we see.
Kayla, you have any other questions? We're able to take one more.
Yes, we have one more question. It's from Yvonne in Cleveland. We hear a lot about social distancing.
Yes.
What is the significance in the 6 feet social distance rule? Why 6 feet?
Yeah, it's we believe the primary way in which this virus is transmitted is through droplets. So if somebody coughs, sneezes, it's transmitted from the mouth, the nose, in the air, and it can be, and that's how it really can infect somebody else. I don't know that it's 100% scientific that it's 6 feet versus 7 feet versus 8 feet. But I think, the main point is to create a fair amount of distance. And actually now we believe that everybody should actually cover their mouth, their nose as much as they can. But again, the main message is to not congregate in large groups, and just to be aware that this is spread through water droplets. That virus actually can live a variable amount of time on surfaces. So again, that's why we emphasize washing hands and cleaning your surfaces, even at your workplace, your workspace, your homes. So yeah, this is it's believed to be transmitted through respiratory conditions.
Thank you so much, Kayla and Dr. Modlin, Dr. Charles Modlin. kidney transplant surgeon and urologist. I just want to thank you from the bottom of my heart for taking time out of your busy schedule to come on and help us educate people about this disease. I look forward to coming to the Minority Men's Health Fair and spreading the word about that again. Again, as Dr. Modlin has said, the roof is on fire. You need to know and understand that this disease does not care if you're rich or poor, black or white. It doesn't matter where you live. Everybody can be impacted by this disease. So please make sure you listen to what Dr. Modlin has shared with us and let your families know that we need to do everything we can to protect each other. Dr. Modlin, thank you very much.
Thanks for having me. I really appreciate it. And thank you for the work that you're doing.
Thank you. Thank
Thanks.
you so much. And right now, what I wanted to do is give you guys an update on the unemployment checks. The unemployment checks, the $600 additional that the federal government has decided to give to those individuals who are on unemployment, according to the Ohio Department of Job and Family Services, will start being distributed next week. So starting sometime at the end of next week, you should start receiving an additional $600 on top of what the state of Ohio has already given you for those people impacted by the coronavirus. Look forward to that. This should help put food on the table. It's not much, but it's something to put food on the table and make sure that you can take care of your family. We are still working on the 1099 self-employed individuals, according to the state of Ohio, Lieutenant Governor Husted, and our governor. That information, that new portal, should be available by mid-May. I know that's bad. We're trying to expedite the process, but by mid-May, that portal should be up. You will get your unemployment benefits as a 1099 sole proprietor or self-employed individual starting the day you could not go to work. So all of that information will come through. I will keep you posted, as always, on this information and more. Again, I want to thank Dr. Modlin for getting on this call, and I want to thank you for joining me today. Thank you so much for joining me. Be blessed and be safe out there.